Ciprofloxacin is a widely used broad-spectrum antibiotic belonging to the fluoroquinolone class. It is designed to treat various bacterial infections by targeting specific enzymes involved in bacterial DNA replication. 1. Classification: Ciprofloxacin is a second-generation fluoroquinolone. Drugs in this class are known for their strong activity against gram-negative bacteria and moderate activity against gram-positive organisms. 2. Mechanism of action: Ciprofloxacin works by inhibiting two vital bacterial enzymes, DNA gyrase, topoisomerase II, topoisomerase IV. These enzymes help bacteria in DNA replication, transcription, repair, and recombination. By blocking them, ciprofloxacin prevents bacterial multiplication and leads to bacterial death. 3. Spectrum of activity: Ciprofloxacin is effective against gram-negative bacteria, E. coli, Salmonella, Shigella, Pseudomonas aeruginosa, etc. Some gram-positive bacteria, Staphylococcus aureus, non-MRSA, atypical organisms, Mycoplasma, Chlamydia. It is not effective against most anaerobic bacteria. 4. Indications. Uses: Ciprofloxacin is commonly used for urinary tract infections, UTIs, pyelonephritis, respiratory tract infections, except pneumonia caused by Streptococcus pneumoniae, gastrointestinal infections, typhoid fever, traveler's diarrhea, skin and soft tissue infections, bone and joint infections, prostatitis, anthrax exposure, post-exposure prophylaxis. 5. Dosage. General guidance: dosage varies by infection type, severity, and patient age. Adults, oral 250-750 mg twice daily. Duration, 5 to 14 days depending on infection. Intravenous, 200-400 mg every 12 hours. Children, used only when necessary, e.g., complicated UTIs or anthrax, under strict medical supervision. 6. Side effects. Common side effects: nausea, vomiting, diarrhea, headache or dizziness, abdominal discomfort. Serious but less common: tendinitis or tendon rupture, Achilles tendon, peripheral neuropathy. QT interval prolongation. Photosensitivity. CNS effects: confusion, agitation, mostly in elderly. Because of these risks, ciprofloxacin is prescribed only when clearly needed. 7. Contraindications and precautions: avoid or use with caution in children, routine use not recommended, pregnant and breastfeeding women, patients with a history of tendon disorders, patients taking corticosteroids, higher risk of tendon rupture, people with kidney impairment. Dose adjustment required. Avoid taking ciprofloxacin with dairy products or calcium-rich foods. Antacids containing magnesium or aluminum, iron or zinc supplements. These reduce its absorption. 8. Drug interactions: ciprofloxacin interacts with theophylline, warfarin, caffeine, antiarrhythmic drugs, antacids, and mineral supplements. Always inform your doctor about all medications. 9. Important patient advice: take with a full glass of water. Do not lie down immediately after taking it. Avoid excessive sunlight to prevent sunburn. Complete the full course even if symptoms improve. Do not take expired ciprofloxacin. Risk of kidney toxicity.